Thank you so much, Debbie, and good afternoon, everybody. Very delighted to join with my colleagues here to talk about Place Matters. Some of my Roundtable colleagues are aware of Place Matters. We've discussed it in previous meetings, but just in brief, Place Matters is a national initiative of my organization, the National Collaborative for Health Equity, which is an effort to build the capacity of leaders and communities to address the social, economic, and environmental conditions, the very determinants that are at the root of health and too often health inequities. So the Cook County team is one example of our teams. We now have 19 teams working across the country to begin to build political will, to build public will for policy and systems change that will address the heavy concentration of health risks that are too often found in highly segregated communities of color around the country. So I'm delighted to introduce some members of the Cook County team who are going to talk about their work toward food justice, which, as I think you'll learn, is very broad and comprehensive in that it talks about food production, distribution, marketing, consumption, not just about what we put into our bodies, but how these systems interconnect. Who produces the food? How is it marketed? Who buys and sells it? So these are some of the issues that the Cook County team has addressed. So I'm going to introduce them all together, and they will come up and present together. Following their presentation, we'll have a brief time for questions and answers. Jim Bloyd is a member of the Cook County team. He's team leader. He's also with the Cook County Department of Public Health. He's responsible for leading community health improvement and planning processes in Cook County. Joining him is Bonnie Renee Rateree. She is a longtime community advocate and longstanding resident of Harvey, Illinois. She has served in many leadership positions there, including serving on the school board. And she's also a master gardener, so she knows a bit about food production. Felipe Tendick-Matesanz is the National High Roads Program Coordinator at Restaurant Opportunity Centers United, Rock United in Chicago, where he's tackling the challenge of creating a sustainable food economy in the United States of America. So please join me in welcoming the Cook County team.
Thank you very much, Brian. Good afternoon. It's an honor to be invited to describe to the Roundtable on Obesity Solutions of the Institute of Medicine the work of Cook County Place Matters. Our main point today is that the roots of the obesity epidemic are in growing poverty and income inequality, structural racism and access to education, and unhealthy neighborhood and living conditions, including access to healthy food, that disproportionately affect people of color. To enact healthy public policy, we need to have organizing of people power to balance the present greater power to influence policy of money and privilege. Underpinning our team's strategy is the research of Adam Dronowski, who writes that obesity research in the U.S. has steered clear of the complex issues of poverty and social class, preferring to deal with individual-level genetics, metabolism, physiology, or behavior. He also writes that diet quality is reliably predicted by education, occupation, incomes, and by other often unobserved indices of social class. But what about public health practice? The National Association of County and City Health Officials, the Public Health Accreditation Board, and the ethics statements of the Public Health Leadership Society all note the imperative to account for power and to change fundamental causes of health inequities. So how do we do that in our team, our Cook County Place Matters? We intentionally build alliances and work with Rock United. Rock United builds power to address racial segregation in the restaurant industry in Chicago and the United States, to increase incomes for tipped wage workers. In the United States, at the national level, the tipped minimum income for tipped wage workers is $2.13 per hour. In Illinois, it's $5.95 per hour. So it's very important that we intentionally work with groups like Felipe Tendick-Matesanz Rock United to change those conditions. We intentionally build alliances with champions of social justice from affected communities, like Ms. Bonnie Rateree, who's a school board member, master gardener, and a leader of the Human Action Community Organization. She mentors Place Matters Natural Leaders youth organizer Mariah Cosby, struggles to provide quality education and quality food for students in her West Harvey Dixmoor School District as an elected school board member, and experiences firsthand what Illinois education finance analyst at the Center for Tax and Budget Accountability, Ralph Rateree, describes as a structurally racist system of financing that selects African Americans and Latinos for very poor education. We're very proud in our Cook County Place Matters team to be only one of 19 interdisciplinary teams working across the United States. We're proud to be one of 19 teams working across the United States through an initiative of the National Collaborative for Health Equity. The mission of the National Collaborative is to promote health equity by catalyzing collaboration among racial equity advocates, grassroots and community-based organizations, researchers, public health professionals, and other key stakeholders. I want to take this moment to thank my fellow team members from around the country and the National Collaborative for their generosity in sharing their tools and lessons learned, and for their steadfast commitment to health equity. This is a snapshot of forces identified by the Place Matters teams that we seek to influence. The outcome of community health at the top box, light blue box, and well-being, community health and well-being, is influenced and determined by mid-level factors, including critical social determinants of health in red at the lower, in brown at the lower left. Structural racism, government leadership, disinvestment, and protective factors. The yellow boxes represent mission-specific disciplines outside of the health arena. The pink box is a critical social determinant of health related to culture and demographics, often not well supported by organized community structures. The green box is the economic foundations for sustainable communities, and the blue boxes are traditional primary care and public health capacity. The cross-sector we work with especially is outlined in the red circles around structural racism, education, the food system, economic opportunity, and local public health practice. The vision of Cook County Place Matters is to build a health equity movement that works to eliminate structural racism and creates the opportunity for all people of Cook County, Illinois, to live healthy lives. We work to raise awareness of the existence of health inequities, and through discussions of films, including the Unnatural Causes series, the Raising of America series, both from California Newsreel. We create and distribute a newsletter. We're developing our presence on social media, and we educate and build relationships with policymakers. When we released this report, Place Matters for Health in Cook County of July of 2012, we were very happy to get the thanks and recognition from Cook County Board President Toni Preckwinkle, who said, after thanking our team, she said, "It's shameful that we live in one of the wealthiest countries in the world and that a person's life can be cut short by more than a decade because of factors outside her or his control." She went on to say, in describing this finding from our report, that people living in areas with a median income greater than $53,000 per year have a life expectancy that is almost 14 years longer than people living in areas with a median income below $25,000 per year. Our team's report made 6 recommendations, including that sufficient funds be allocated to increase healthy food retail in neighborhoods with low food access, that the voices and aspirations of neighborhood residents be reflected in solutions to hunger and poor nutrition, that we assure workplace justice for workers throughout the food chain, and we specifically included the restaurant industry, and that persistent poverty be addressed by engaging multiple sectors. And we finally endorsed the idea that the 2008 World Health Organization final report of the Commission on the Social Determinants of Health be implemented. The next series of slides show population demographics and show the relationship that we see as very important between health status and diet. The 3 bars on the right show indicators in Harvey, Illinois, of childhood poverty percent and indices of adult poverty. In Harvey, the child poverty rate of 45.4% is 6 times greater than that child poverty rate in North Suburban Cook County, which is the small blue bar on the left. In South Suburban Cook County as a whole, where Harvey, Illinois is located, we also see significant larger rates of child poverty and of adult poverty, all population poverty at the 102% level. We also see diet, actual intake of healthy food, inequalities by race. Black suburban Cook County 9th graders reported eating less fruit during the last week, eating fewer green salads during the past 7 days, and also eating fewer carrots in the past 7 days compared to other racial groups. I'm sorry about that. Finally, just very quickly, this north-south region shows that two-thirds of residents in South Suburban Cook are people of color, whereas two-thirds of residents in North Suburban Cook County are white. This slide shows the dramatic effect of segregation on Metro Chicago, which exposes almost exclusively poor children of color to high levels of concentrated poverty while locating poor white children in neighborhoods of low poverty. While 90% of poor white children live in low-poverty neighborhoods, about 75% of poor black children and 45% of poor Latino children are exposed to the health and life-threatening environments of higher poverty neighborhoods. This is also described by the 2008 IOM report by J.A. Cohen. This is an example. Segregation in Chicago, which we just saw in the previous slide, has some of its roots in the state-sponsored segregation of the 1930s Homeowners Loan Corporation, represented here by the HOLC map of the south side of Chicago. Finally, before I introduce Felipe Tendick-Matesanz, I want to point out that an example of addressing this power imbalance that leads to lower wages for workers in the restaurant industry is our signing on to this April New York Times full-page ad that urged members of Congress to stop taking National Restaurant Association's corporate cash. This was an effort by the Restaurant Opportunity Center United folks from around the country to balance this power of a particular interest group in which ROC United brought workers and brought business owners of small and medium businesses to show that they actually believe that it's more sustainable and more socially just to address these injustices in wages and income for restaurant workers. Felipe?
Thank you, everybody. Thanks, Jim. Good afternoon. I'm honored to speak on behalf of our Place Matters team. I'm honored to be one that speaks here today about the 13 million human beings that prepare, deliver, and serve our nation's food in the food service sector, the second largest private sector in this country. I'm also humbled, and I owe an insurmountable level of respect and gratitude to the generations of thought, action, community building, and sacrifice to shape a human experience in which we are all guaranteed our human rights, an experience I've been intentional in integrating in all that I do, and that I hope that hopefully after this conversation I plant a little seed and that you start thinking about a lot of the conversations we've been having today is actually a human rights conversation versus just a public health conversation. To further perhaps plant that seed, and this is bad on my part, you're always supposed to cite your sources, but I couldn't get the source, but I thought it was very important to mention this. This was in a recent high-profile journal in public health realm, which said that public health and human rights are therefore typically congruous, that public health is most effectively protected through the promotion of human rights and the protection of the inherent dignity of the person. And so before I delve into the rest of this piece, I want to be really intentional in building community, and so I'd like to just share my story very quickly and what we like to do in community building. So I'm the proud son of a first-generation immigrant mother from Valdemonte, Spain, who lived through the Franco-fascist era, and a veteran father, two-time cancer survivor from Chicago, Illinois, who is an example of a successful educator who was pushed out because he didn't fit the internal political scene and didn't teach to the test, which I know Bonnie will have some interesting things to say about that later, which is too common in Illinois. Growing up in my family, we owned a fine dining restaurant from the 80s to the mid-90s. I was proud to say that we had higher wages, actually had paid sick days and benefits. I worked in the restaurant industry for about 5 to 6 years, several low-paying positions, and eventually became a founding member of the Restaurant Opportunity Center of Chicago. And since 2008, since I've discovered and found rock, there was a fire that lit within me, and I've been building power with workers and addressing inequality and inequity in the food system ever since. So thank you for letting me briefly share my story, and I'll go into more of what we do. So the Restaurant Opportunity Center is the only national nonprofit dedicated to improving wages and working conditions of the country's more than 10 million restaurant workers. We're a member-based national worker center with more than 10,000 members, with local offices in 12 major cities, and our innovative approach to system change has 3 major components: research and policy, workplace justice, and promotion of the high road to profitability. At our core is the human right to work with dignity, and we provide this through building power and community organizing with workers, owners and entrepreneurs, and consumers to create what I like to call a shared prosperity outcome. So why do we do this? And this is the slide. I was hoping you'd all read it while I was talking. I'm hoping that you've seen this and some things have popped out at you. To juxtapose this slide, the reality of the business side of the industry is that it's booming. It's one of the fastest growing and most vibrant sectors in the United States economy. While other sectors have stagnated or declined, the restaurant industry provides consistent growth year after year after year. To elucidate a little further, this year marks the 15 years of overall job growth, outpacing the overall economy, with over 12 million people making up, well, I said 9, but it's actually 10 now. It's always changing. 10% of the total workforce, and placing it as the second largest employer in the United States. This year also marks the completion of 5 consecutive years of real revenue growth and record high sales that are projected to reach $683 billion at the end of this year. Through our research, we've found that the industry has some of the nation's lowest paying jobs with little access to benefits and career advancement. Yeah, there's between 6 and 7 of the 10 lowest paying jobs in this country are actually in the restaurant industry. Nearly 90% of workers do not receive paid sick days, and lower wage positions within the industry are predominantly filled by women and people of color. We also found that racial discrimination is widespread in the restaurant industry, and 28% of workers that we found have been passed over for a promotion reported that it was based on race. And we find it reflected in wages as well, as the median wage for a white worker is $13.25 compared to $9.54 for workers of color. And this is not to mention the stagnation of wages, rampant labor violations, consistent failures to ensure occupational health and safety, and that also pose public health concerns. For example, the federal tipped wage, as Jim was mentioning, has been frozen since 1991. Under federal law, employers are required to make up the difference between the tipped wage and the minimum wage. And according to a recent Department of Labor investigation, 84% of employers were found to be in non-compliance. I don't know if that doesn't rile you up, but it usually gets me pretty riled up. So what are we doing about this? What I want to really pop out at you from this slide is especially on the lower bottom, it's in purple, good. So 40% of tipped workers, which are a larger majority of the working force, are single mothers. And so when we talk about wages, it's not just wages, this is actually a woman's issue. And if we delve even deeper, we know that women are they're essential for not just health outcomes, but also the progress of most countries. If you go to other countries and we do global metrics, it always comes back to the women. They're the core of our progress. So I think this is a very alarming truth that we have to face. And so what we're doing is we are working with several workers across the country to address these injustices. And so right now we're tackling large players like Darden Corporation, which is all your Olive Gardens, your Capitol Grills. They own about 13 brands. They're the largest private sector employer in that industry. We've found consistently poor working conditions. So what we're doing right now is working to change that and to improve the working conditions across the board. And we're putting a lot of pressure, which they don't like, to change the working conditions in the restaurants and then influence other players, because often the mantra is copy what good business, big businesses do. They must be doing the right thing to earn all that profitability. What we're trying to say is holding them accountable, and they're actually cheating a lot of small, medium-sized businesses by undermining the business market. And so our goal is to kind of bring that to light, bring other business owners, bring workers together, and change those conditions. Also here recently, am I over? No, I am over a little bit. So just recently, just one thing I want to plug DC, because we're really excited because we're here as well. We just helped with a coalition pass the first paid sick days law in DC, and that just passed, I was here like 6-7 months ago. So that's really exciting. So now like in DC, for example, every business, every location, restaurants included, have to actually have paid sick days, which we know is a very important and essential need for many of us if we're going to talk about health and health inequities. So I could go into a lot of detail, but I will just simply say that it's been great working on that team, and it's been very interesting to be able to build power, and even that the fact that I'm here and that we're here today just proves that what we're doing is already being successful, speaking to a group like you whom we normally wouldn't be able to speak to. So thank you again, and I'll let Bonnie come up and speak. Thank you.
Well, thank you, Felipe. And thank you for inviting me to participate in this event. The people who are most adversely affected by these policies are not often in the room. I'm here representing the working poor of South Suburban Cook County. I began working with the collaborative of Cook County Health Department, the City of Harvey, Ingalls Hospital, the Harvey Community Center, School District 147, and the Human Action Community Organization on food justice issues. Oh my goodness. Oh, thank you, Jim. When I saw him stand up, I realized his biggest fear, I am not that computer literate. This is my first time having to do this, but I'm gonna get through it. We began working together on these food justice issues, and I ultimately discovered through the Place Matters research data that my community not only has been discriminated against, but also it's been by design through public policies and through public procedures. Just to look at the slide for a moment, we talk about strengthening voices and policy on education, nutrition, and neighborhood conditions. You're talking about my neighborhood. You're talking about my home. The slide shows you a collaborative project that I'm very proud of. You're looking at a playground that we built collectively with Kaboom. I should say, I really don't have a slide that shows Michelle Obama. But she's lived right up the street from me, and she'll be coming home pretty soon. And when she does, she can look at the Kaboom playground that we built with The corporate interests, we had, Fannie Mae workers. We not only got some funding from them, but 100 of their staff people came out and helped us. I laid concrete. I shoveled concrete all day because with the Kaboom project, you are not allowed to use the fancy equipment. You got to do it the old-fashioned way. I happened to be off work on sick leave, but I was volunteering, so it didn't matter. But we built the playground, we built the garden boxes, an outdoor classroom. I feel like Socrates when I'm out there teaching. It's just a wonderful experience and to show what we can do when we collaborate. Well, I guess my strong feelings come from the fact that I'm a school board member in the same community, in the same school district that I was a student in. My mother let go of my hand back in 1952 in that school district, and I haven't found my way out yet. I've been on that board off and on for quite a long time because I think education is really very important. When I started kindergarten, I was in a 20% minority. When I graduated 8th grade, 80% of our population was black and 20% was white and Hispanic. When the racial composition changed, we also changed how we educated and provided health care for our children. When I was in grammar school, the teachers spent time and resources educating the white kids. We were in the room, so we learned too. When the racial change came about, we stopped getting the quality education that we had before. We stopped getting the funding because we stopped caring about the children in the room. Someone said, people really don't care how much you know until they know how much you care. And one of the reasons I wanted to speak to this group is because we all have this one thing in common. We eat food. There's not a person in here that doesn't eat something, okay? And so when you sit at your table eating your healthy food with all the greenery and all of that, I want you to think about my students. You see, I'm teaching them to plant their own gardens and raise their own food. But as a school board member, policymaker, decision maker, leader, I'm subject to only giving them what I financially can afford. And so, although I'm teaching that we should eat more green foods and we should eat more fruit, when I sit down with that budget, where people in my neighborhood get the least amount of money for education, then the food that we provide for our children through the breakfast program and the lunch program is dictated by the amount of money we receive. Ralph Matire's research shows that in Illinois, we're 50th in education funding, which means 49 states, including Mississippi, spends more money on public education than we do. During slavery, it was legal to deny us our human rights. After that, Jim Crow laws were the public policy that kept us down. Now, I'm going to tell you, I get very uncomfortable when I talk about race in a group like this, because very often, shut you down. You don't want to talk about it. We often don't want to think about it. It's that ugly part of our history that we wish would just go away. But today, we use geography to continue this unequal system that causes obesity, chronic diseases, and early death. Food deserts exist in a neighborhood where grocery stores and community gardens used to stand. When I was a kid, my grandmother trained us to raise our own healthy food, preserve it, and eat it. I'm a master gardener now, and although I teach children and their families to grow their own healthy, nutritious foods, Public policies won't even allow them to eat the food in some instances that they planted. Instead, they're given government commodities, not the fresh foods they need to grow, learn, and not become obese. Not only does teaching children to grow gardens motivate them to eat healthy, but it also teaches them the importance of nutrition, the sciences, math, and character development. It also exposes them to opportunities for careers as entrepreneurs in fields of health and nutrition. My community was a viable, strong, middle of America, small town America place to live. When I was growing up, there were 2 jobs at least for every household. But as the race changed, the jobs are not available to the people in the community. Very often, people come from outside of our community to work with us and tell us what we should do with the resources that we don't even have. Education is a right, yet our laws, our policies, and procedures have historically and to this very day denied a particular group of people, people of color, their human rights. I want to thank all of you, and I want to thank my colleagues for inviting us here. I want to thank the Place Matters National Group. It was through my involvement with this group that I finally figured out I'm really not a little crazy woman after all. In the 60s, I was a militant because I told the truth. In the 70s, I was one of those crazy women that was talking all that women's lib stuff because I told the truth. Today, I'm empowered. I'm going back home to work with Human Action Community Organization to raise the consciousness of my neighbors. And I'm asking you, all of you who are here, who are in any policy-making positions or influencing policy, please realize that what these communities need more than anything else is the same resources you have in yours. Thank you.
Thank you. Thank you. I'm not sure if my mic is working, so I want to thank this amazing team. I'm very proud to be part of Place Matters. I know we're running short on time. We're going to make up the time. We're going to take some questions, and I encourage you, if you have a question, to go to one of the microphones as we have earlier today. But I just wanted to comment that I think you see the power of the work that we're doing, combining the kind of research that Jim showed, documenting the inequitable distribution of health risks and resources across communities, the kind of activism that both Felipe and Bonnie have talked about, organizing in the community, combined with insightful policy analysis to point to solutions. So inherently, obviously, this is cross-sectoral work. We can't do it through Jim's health department alone. We can't do it through Felipe's labor union alone. And certainly, Bonnie, as a dedicated school board member, can't do it alone. We have to figure out a way to work together. So let me just pose an initial question and ask each of my colleagues to respond. And then again, if there are questions, we'll go ahead and have you come up to the mic. Because this work is so cross-sectoral, can each of you talk about how did you begin that conversation? How did you move from health department to labor union to school board to reaching out to academics, elected officials? Let me make a little plug. A former Cook County Place Matters team member is now serving as a member of Congress, Robin Kelly from the 2nd District of Illinois. These are the audiences that we need to reach. So can each of you say a bit about how you began that conversation and sustain the kind of collaboration across sectors? What does it take to help you come to the table together and continue to work together?
Let me start out quickly. I think it was a gradual process, Brian. Our team has always been interested in looking at nutrition and food systems and food justice. We were very excited in trying to promote and further the real ideal healthy food financing initiative in our state, and we're very interested and active in that. And in part then through that work, I met Bonnie and from her master gardening work and organizing community gardens and farmers market in Harvey. We developed a relationship, and I became aware also then that our team really had some big discussions about some of the directions that we thought the alternative food movement was running. And on our steering committee, which it was on the last slide, we have a 6-member steering committee, which is representing multiple institutions. We really discussed the fact that we thought that labor in the food system was absent from most, not all, but probably most discussions, and that really fairness and social justice needs to go for everybody in the food system. And so that people who produce, who harvest our food, who cook it, who prepare it, who serve it to us in restaurants, need to have the same ability to feed themselves and their family nutritious foods. And so we thought we would take that step and really consciously work with labor. And Rock United was a perfect example of that.
Others?
Oh, well. Actually, I will never forget the day I met Jim Bloyd. I was at a meeting of my then congressman. Well, actually, the village of Dixmoor is a very tiny community, much smaller than Harvey. It has 2 congressmen in that little place. And so Bobby Rush was one of the congressmen, and Robin Kelly is now the other. But Bobby Rush had an organization called Good Greens Project, where people came together to work on food justice. Well, I was very interested in food justice, and since I've just about tried everything, I worked in criminal justice. I did a program called Mothers in Prison, knew nothing about that when I went in. I came home with a 4-day-old baby girl. I looked across the room in one of the meetings, and I saw my childhood boyfriend. He was the deputy director of corrections. And I'm standing there with a newborn baby girl, and I mean, I don't think we ever kissed. But I'm feeling like I'm stuck with the baby, and he's gone on. And so all of my life, I have just tried to do my part in making things better for my people. And so this time I thought, well, food justice is just as good as criminal justice, just as good as women's rights, just as good as environmental rights. I'll try this. So I'm at the meeting, and I had been attending the meeting for quite a while when Jim came in. And it's a Chicago meeting. I'm from the suburbs. Now, my suburban town is poor, but people think of the suburbs as they think of the northern end. And so nobody thinks I need anything. And so they had already divided up the little funding that was going to be there. Jim is sitting there from the prevention grant that he had received for Cook County. And everybody is saying, well, we don't have enough money. We just divided it up, but it's not enough. I'm sitting here with nothing. And he says, well, I've got some money. They had just received $16 million, I believe, in a prevention grant. And he looked over at me and he says, actually, I can't share this with anybody but you, because you're doing the work that we're talking about, and it's for suburban Cook County. And that's how we met. Of course, you don't want to hear the horror story of how that money didn't trickle down. It never does. It never trickles down to the bottom. But in my community of Harvey, we didn't need a trickle down. Because if you have jobs in your community, if you have small shops, when I grew up, I could go down 154th Street, there was a baker, there was a butcher, there was a candlestick maker. And so we had everything we needed, you know? And so I don't worry about the trickle down. But my God, at least let us have the resources at our level. Now, My town is like a third world country. People come in from outside. They teach our kids. If I weren't here today, I'd be negotiating with my teaching staff this afternoon. I'm the chairperson of the negotiation team because I'll say it. But I've got a lawyer that works for me that doesn't live in my town. He's making thousands of dollars every time he sits there to negotiate. I've got teachers who have a union and are being paid to sit down with me. I can't even get my whole committee there because they're not going to stay late enough in the community for the people on my board to come from work. And yet, in their union contract, they have the first right for every job that becomes available in my school district, which means my neighbor who's about to lose her house, who's a great cheerleader, volunteers at the school, she applies for the cheerleading coach position. It might not be enough, but it might help pay that mortgage. She can't get it. Some crotchety, no disrespect, old teacher that can't even raise her right leg gets the job. And then to add insult to injury, I've got to sit there when she loses her house and my taxes go up higher to pay the salary of the people I'm negotiating with who come into my town and don't have the love that those teachers had when I was a kid. Now, I want you to understand, it's not just race, it's class, because I had a lot of white teachers when I was growing up, and now we have white, black, and Hispanic teachers. But if you don't think that those little kids in your kindergarten or 8th grade class are as important as your kids, then I don't think I should be sitting there as a volunteer on that school board all day negotiating, and you're going to win. So all I'm saying is my relationship with these guys has grown because my sophistication about how this issue has really developed has grown. And I want to thank you, Brian, and I want to thank you, Jim, because if it were not for the data, you see, I get fed the data all the time. You read the data in the newspaper all the time. Oh, that guy with his pants hanging down just killed somebody. Nobody talked about the hopelessness that's in my town, or the fact that he's preying on people like me, because maybe he didn't get an education. And so I'm stuck. Lucidity is a trap. I get calls from my daughter in Texas, my son in Colorado, and they're saying, Ma, get out of there. And they just start laughing because they already know when they hear it, I'm not going any darn where. This is my community. I was here when it was good, and I'm not leaving until it's good again. That's my story, and I'm sticking to it.
Felipe, let me let you have the last word, Felipe.
How do you have a last word to that? I don't even know what the question was.
I'm sorry.
No, it's fine. I think this is what unite. I mean, we have this common core. We've been practicing for this conversation, which took a little turn for some of us up there. But it evolved, and we found a common core, and I think it was really the human rights conversation that we were having, and really a lot of our focus has always been like building from the ground up. That's a lot of the challenges that we see in today's society is that, you know, what Bonnie's talking about is top-down approaches to everything. When we talk about evaluation, I was interested to see, what about participatory evaluation? Does the community create the evaluation? Do they learn? And do they get to evaluate themselves after you leave? Are those key pieces part of the puzzle? Are they not? So when we talk about justice and I think how we create more equity, especially we're talking about obesity, but the truth is all these factors we're talking about equals obesity. So obesity is just one little piece to the puzzle, and there's a lot of other components that connect to that. So I think a lot of what we talk about is just kind of how do you base build, how do you create decision making on the ground for those who are affected, and then because they're the experts. I mean, the people who are affected are often the experts to their own challenges. So it's really easy. Just go in the community and ask them what they need. You know, I like some of those approaches people are saying. You know, that's what you do. And then they will come up with the solutions. And, you know, there's been some talk now from economists recently to say, just pay everybody instead of, let's just pay everybody like one single wage across the board, just with the tax revenue, looking at how much that would actually cost the government. It's a little bit progressive, I think, most likely. I would love to see something like that or similar to that. But it's an interesting concept. It's an interesting question to have. How much are we perpetuating poverty? We talk about alleviating poverty, but how much are we part of the problem? Maybe it's not right to have me in this role. Then I should step down, let somebody else come in. Does it make sense for our organization, our placement, to exist? And if it doesn't, then we need to give it back. So I think we all came kind of from this core of like building together and from the ground up, and new approaches to change. So
Excellent. Please join me in thanking this wonderful panel. I apologize that we have run out of time. I see that you wanted to pose a question, but I'm sure our panelists will be around during the break. So again, thank you for your patience. I'm now pleased to bring our next panel to the stage. We will be hearing from Bill Dietz, consultant to the Roundtable and director of the Sumner Redstone Global Center on Prevention and Wellness at the Milken Institute School of Public Health, that's not easy to say, at the George Washington University, who will facilitate the next case study presentation and discussion, Power Up in the St. Croix Valley, a regional example. Thank you.
Thank you, Brian.